Thank you all for joining us today for this Reframing Retirement event and today's topic, Ending Ageism Together, presented by Kris Geerken, co-director of Changing the Narrative. We want to thank the Pikes Peak Area Agency on Aging and Ant Credit Union for collaborating on this series. We ask that you please use the chat function to ask any questions as you have them. You can also rename your profile so we can actually call out the correct person whenever we have time for questions. And now it is my pleasure to introduce our presenter, Pamela Hogard, Case Manager at the Pikes Peak Area Agency on Aging. Pamela, it's all yours.
Thank you very much, Jared. We have our keynote speaker, Kris, and I'm going to tell you a little bit about the Area Agency on Aging and a little bit about why we changed the name to Reframing Retirement. We're in our 9th year with Ant Credit Union. Bree Shalito will be joining here shortly. She represents Ant, and she'll say a few words in a few moments about the program. As I mentioned, my name is Pamela, and I'm with the Area Agency on Aging. And we are a resource agency specializing in older adult information assistance, public education, and publications such as the Yellow Book and the Veterans Benefit Book. We also house the SHIP department, which is the state health insurance program, and we give unbiased information on Medicare and health insurance. So we wanted to open up the series this year to invite people to think a little bit more outside the box in terms of retirement. So is it fact or is it fiction? So that's what we hope to confirm in our modules today. You know, life lessons didn't come with the manual, and retirement is one of them. And what's happened is that back in the 1930s, people lived to about the age of 65. And so to retire at 65, that's when the word retirement really came in vogue. And so to retire at age 65 was just a few years later that, you know, they had a few years off, and then perhaps, that was it. However, our life expectancy now is just under 80 years. So about 1 out of 4 65-year-olds will live past 90, and 1 out of 10 will live past the age of 95. So what we're experiencing now is longevity, with the possibility of 20 to 30 or more years to live and to create the kind of life that you want. So the new mindset is what's next, rather than just saying, hey, I'll see you later kind of thing, which, back in the day, that's the way it was. So we hope that you'll find these modules interesting and useful. So now what I'd like to do is introduce Bree Shalito, the Senior Manager of Community Impact, to say a few words about our partnership and about our series. Bree, it's all yours.
Thank you so much, Pamela. Hello, everyone. Thank you for being here tonight. As Pamela said, this is our 9th year in partnership for this series. We've certainly added as years have gone on, just based on feedback from those who have joined us. So thank you so much. If you've joined us in the past, you'll be hearing some information as a duplicate, but for the most part, a lot of this information is brand new, including tonight's session. So Ent is pleased to support this partnership, and also to just have this series as something that our communities can turn to for information about this tricky topic. So my name is Bree Shalito. I work for Ent Credit Union. Ent is Colorado's largest credit union. We're just approaching about $10 billion in asset size. We serve over 550,000 members across Colorado. And overall, our mission is improving our community's financial quality of life. So this partnership fits in very well with that, as does this series. We're also excited to offer a door prize for these sessions. You must be present until the end. Kris has been so kind to give us a few moments before we jump into Q&A for the session. We'll actually do the drawing right here. We can do any $50 gift card. That's an e-gift card. So we'll be able to do either Visa or Amazon, or if there's something else you'd like, we can do an e-gift card for you. So we'll do the drawing live here tonight. So you'll be able to see who wins, and then I'll connect with you to get you that money. Well, thank you so much, Pamela. If there's any other questions about Ent or the PPACG, I'll turn back over to Pamela to introduce our speaker.
Thank you, Bree. Appreciate it. We are honored and very glad to have our speaker, Kris Geerken, with us this evening with Changing the Narrative. She'll be leading you in the topic of ageism and how that relates to retirement and the longevity of your life. Kris is co-director for Changing the Narrative. Changing the Narrative, which probably many of you know, is the leading effort in the United States to change the way people think, talk and act about aging and ageism through the evidence-based strategies and innovative public campaigns. Kris developed Changing the Narrative's age-friendly healthcare initiative. In addition, she is an adjunct instructor at Metropolitan State University in Denver, teaching the course Aging and Society. She holds a Master of Health Administration degree as well as a BS in Human Development with a concentration in aging issues. Please, let's give a warm welcome to Kris Geerken. Kris, it's all yours.
Thank you so much, Pamela, and thank you to Pikes Peak Area Agency on Aging and Ent Credit Union for having me. I'm so excited to be here with everyone to kick off the Reframing Retirement series. So I will share my screen, get my slides going for you all, but it's wonderful to be here with everyone. And I'm just so excited that you've decided to kick off the series with the focus on ageism, because obviously it's a very passionate topic to me. I think it's really important for all of us to understand it. And retirement, like aging, is diverse, right? And when it comes to aging, we know that the older we become, the more diverse we are. And that shows up from our lived experience across the decades, the different identities that we carry through our lives, and just the histories that we've experienced. All of that creates diversity as we become older people. And retirement, however you choose to define it, is also just as diverse. So we think it's very important that we tie these together so that the more you're aware and conscious of what ageism is, the more you may have a positive experience as you're aging. So I want to have this start off with an interaction with everyone, so everyone can type into the chat. And Pamela and Bree, if you're able to see the chat. So what this is about is a birthday. So if you have a birthday coming up, or if you've recently celebrated a birthday or had a birthday, I want you to look at these little pictures. Number one, where the person is that represents that, oh, you just would rather never have a birthday. You hate your birthday. It's something that you don't think positively about at all. Number two is that you're just in the middle, like you don't care one way or the other. You don't hate it and you don't love it. The third picture is showing that you love having a birthday, you love to celebrate that you're getting a year older, and you think it's a really positive experience to have this birthday. So in the chat, if you could type in how you feel about your birthday, 1, 2, or 3, and then they can share if they're seeing lots of 1s or 2s or 3s, that would be wonderful.
Seeing some 3s and 2s.
Oh, that's good news. Right. That's great. So this is an opportunity for us to be thinking, right, about when you think of your own birthday, that represents aging, right, and getting older. And why might we have negative or positive or neutral feelings about our own birthday and getting older? And we're going to dig into that in tonight's presentation on why we feel the way we do, why we might feel the way we do about aging positively or negatively. So I'm going to address that. So thanks for checking the chat. I appreciate that. So why you? Why all of you? And why does this matter? Whether it's in your professional life, your personal life, all of us can have an impact and influence on the other people in our lives, personally and professionally. So as the thing that we all share is we're all aging. And if we understand ageism, then we can start to do something about it. We can share this knowledge with others, and then that will carry it forward. And sort of in that model of a grassroots movement, the more we understand ageism, the more likely we are to reduce it. And ultimately, like our goal at changing the narrative is to end ageism. So it's going to take all of us as individuals to come together. And we have this opportunity to share what we're learning and the way that we talk about our own aging, and not using the assumptions and stereotypes that we see that are so dominantly negative in society, countering those and helping to create more positive images and messages. So all of us can take action in small and big ways, and I'll share more about what that can look like for all of you here today. So in the work that we do at Changing the Narrative, we always include the definition of ageism and explain what it is so that people understand. So we recommend that that's what people do as they're sharing information about ageism. So the definition that we use comes from the World Health Organization, which they define it as the prejudice, stereotyping, and discrimination directed towards someone based on age. So it's how we feel, think, and act when it comes to age and aging. And the important part for people to understand as well is that it's not only older people that experience ageism, it's also younger people. And an example of how ageism can show up for a younger person, one of the common examples would be in the workplace. So if someone is younger and they're not considered for a promotion, or they're completely overlooked because it's assumed that because they're young that they lack experience and lack enough knowledge to be promoted or to be given a chance to have an opportunity for an advancement in their company. So that's a common way that it shows up for younger people. And I have lots of examples in my presentation for older people on what it shows up like. But one of the common ones is technology, right? There's a stereotype that older people either can't learn technology or not interested in learning how to use technology, but we know that that's not true, but that's an assumption that we hear in society, and that's not okay. So we want to change that narrative. And the graphic that you see there, that comes from the World Health Organization and the United Nations, who back in 2021 launched a global campaign about ageism, specifically worldwide. So it's not just an issue in the United States, it's something that's happening around the world. So it's important for us to also recognize that this is kind of a universal problem that we all can participate in addressing. And in addition to that, they found that intersections of other identities, so like sexism and ageism, racism, all of these, when they intersect, it just compounds the negative impacts of aging if we have other identities that are historically oppressed and marginalized. So it's also an important part for us to understand how ageism can be compounded as we're aging with various identities across the lifespan. And we also know that we're an aging nation, right? And worldwide, we're seeing this, that by 2034, 2035, older adults for the first time in history are going to outnumber children. That's remarkable. And there's a lot of wonderful things about this, right? That we're living longer. As Pamela mentioned earlier, it's such an opportunity to make the most of this extension of life that many people will get to experience. But at the same time, we do know that our systems and our structures haven't adapted to this demographic shift. So what can we do to help be part of making this better, a better world for us to age in and not let ageism dominate as it does at the moment, So we have to change that narrative as well. So learning more about ageism and the influence it has on our lives is really the first step to take. So here, I'm going to have you all interact again. So on this slide, you can type into the chat any one of 1, 2, 3, or all of them. But have you ever either lied about your age, said or thought, I'm having a senior moment, or thought, I'm too old to do that, or said that I'm too old to do that? If any of these or all these apply, could you type that into the chat, and then they can let me know if anybody's had these experiences personally. Because these all represent internalized ageism, the beliefs that we have kind of maybe subconsciously that just sort of kick in.
1, 3, 2, 2, 1,
Everything.
2, 3. Yeah, you've got the whole gamut here. No to all.
Yeah.
That's good. No to all. Some of them were getting no to all of them, so that's cool.
Great. Good audience. I love
Yeah.
it. So see, this is encouraging. So these are reflections of ageist thoughts and beliefs. So this is helpful for us to recognize. These are examples of what it can look like, right? And then here are some more that you can type into the chat. So have you ever told someone that they look good for their age, or sent someone a birthday card that makes fun of aging, or called someone older than you sweetie or honey, and for experience workplace discrimination because of your age? So feel free to type in 1, 2, 3, 4, whatever applies to you.
Wow. 2 and 4.
Okay.
2 and 4. 2. All of the above. 4, 1 and 2, 1.
Ah,
1,
very-
all, 1 and 2, all 4, 1, 2 and 4.
So we got a lot. There's
Yeah, 1.
This is good to hear, like helpful to know, right? So what we say in our work at Changing the Narrative is, so instead of saying you look good for your age, you can say you look good, right? Because age, when we add age to it, it's implying that there's an expectation that at a certain age, we don't look good. So we just want to remove the word age from that. So just tell people they look good. And with the birthday cards, we actually have a campaign that's focused on age positive birthday cards, because Janine Vanderberg, who developed Changing the Narrative starting back in 2018, she was so frustrated with so many negative birthday cards out there about aging and just depicting older age as something negative, that she thought we have to do something about that. So she commissioned artists across first Colorado, then round 2 or artists across the country to create age positive birthday cards. So we have that on our website, and just there's other ways for us to describe and depict and celebrate aging, right? It doesn't have to be made fun of. And then the sweetie or honey, that's a representation of elder speak, which is speaking to an older person as though they're a very young child, and it's demeaning. And actually research has found that causes harm to people mentally, physically. It's actually harmful, but not intentional harm. Obviously, like we are saying endearing terms to be kind, but it actually is not helpful to someone. It actually can be harmful. And then the workplace discrimination because of age, we have a whole campaign all about workplace age discrimination, and lots of great information on our website, but that's a real problem, and we need to help change that one as well. So I'm going to now share with you recognizing ageism. What are the different ways that we can start to recognize it so we can do something about it, right? So these are just some different pictures that are out there on the internet and that we see in potentially our everyday lives, on television, in stores that we go to, where we see anti-aging products all over the place, pictures that just only show images of getting older as a period of decline and depression, and all of these negative images and wording. So that's not okay, right? When we see such a dominant negative message about getting older, and we're not seeing positive ones, then how are we supposed to shape and form our own ideas of what it might look like for ourselves to age, right? And we need more positive examples of that, and the diversity that actually goes along with it. And so it really creates this cognitive dissonance, right? So how do we see ourselves when we're inundated with all of these negative messages and images in our society? But then at the same time, we also recognize that we are all aging, every one of us. So we have that reality that we're aging. So we need to just see more positive images of that. So when you see the negative things out there, pay attention to it, and just note that, like, that's ageist, right? So what could I do to counter that or not support that? And where it begins is in childhood, right? As research has found, Dr. Becca Levy from the Yale School of Public Health wrote a book last year called Breaking the Age Code, which I'll refer to a couple of other times in the session tonight. But she found that when we're around age 3 or 4, we begin to subconsciously absorb the messages about aging and older people as something negative. And it shows up in storybooks, fairy tales. The older adults that are in our lives influence us in the ways that they talk about aging and talk about other people aging. So it's something that's implicit and it's unconscious. And so that's important for us to recognize, because if it's starting in childhood, we weren't born thinking these things, right? So that means that there's an opportunity for us to start to challenge and change the way we're thinking. So I think it's a positive thing to know that I would love to be more conscious, and so I can do better so that I can age well. And then this is a representation of what ageism can feel like. This is based on feedback I've had from many workshops that I've done with especially older adults in healthcare situations, but just thinking about these words, right? Like what it feels like to feel invisible, or depressed or disrespected, overlooked, marginalized, and devalued. No one would want to feel like any of these, right? But we have, because there's such a negative messaging about aging, and these are the experiences people are having, that's sad, right? That's not acceptable to me. And I want to help. That's why I do the work that I do, because I really want to change it. And I just don't want anybody to have to experience these feelings. So this is part of why it matters to me in doing this work that I'm doing. So hopefully all of you can appreciate that this is something that we can change. And so these are some examples of the negative impacts that ageism has on us. And the first one, like on decreased financial security, this is from a study that was done by the Urban Institute of more than 20,000 participants. They were all people that were in their 50s or over age 50 who had full-time stable employment and were salaried, but 56% of them were either pushed out or laid off, and only 10% of them ever recouped financially. So that's because of ageism is why that happened. And then Dr. Becca Levy from the Yale School of Public Health, who I just mentioned, she is a leading researcher on ageism, and in her research found that people that experienced ageism and also had negative beliefs about aging lived on average or shortened lifespans up to 7.5 years. Their lifespans were shortened up to 7.5 years. So that's another important reason why we need to understand how ageism is impacting us. And in addition to that, experiencing age discrimination, ageism, is also associated specifically with increased depression, stress, anxiety, and cognitive decline. So all more reasons why we would want to understand what it looks like so that we can do something about it and start to see it in a different light. And then here are just some examples of how ageism shows up in our communities. And these are from different sources, but Frameworks Institute, who's a national public policy firm that researches strategic communications, they found that ageist beliefs and practices erode support for systems and policies that would otherwise make communities more age-friendly or age-inclusive. So we see across the country less support for age-friendly policies and systems and programs, lower funding for older adult programs. Levy's research found that annually $63 billion was being attributed to ageism in healthcare. And workplace age discrimination cost the economy $850 billion. That was in 1 year as well. And that came from AARP. So it's not just individual, it's affecting us even across, in our communities across the country. So now thinking about ageism in this ideological way, like in our society, this messaging that we see across society in all these different ways, and why is it the way it is? And these are different examples of how it shows up and why that is the case. And we're going to kind of break this down into each section. So when we look at individualism, the United States has kind of evolved into a very individualistic mindset as a population in general. It's kind of our messaging in our country, and how this applies to aging and ageism are beliefs that if somebody isn't doing well as they age, then maybe they didn't save enough and they didn't take good care of themselves, or they didn't keep up their job skills. And individualism is a dominant pattern of thinking that is that how we do as we age is primarily or solely the result of our good or bad personal choices. When this thinking is applied to aging, the public reasons that whether someone ages well is a consequence of either personal finance or personal choices, financial decisions, lifestyle, and health choices. So the problem with this is that it obscures the social determinants and the contextual factors that influence the outcomes we experience as we're aging. So for example, that could mean access to food or healthy foods, transportation, having to maybe step out of the workforce to care for maybe grandchildren, other family members, neighbors, or other people, accessing employment or retirement plans, maybe having lost a job, healthcare issues like health problems could have occurred. There are so many factors that are beyond the individual's choice that can attribute to how we age and what that looks like, and whether or not we may be suffering as we're aging. So then there's the ideal versus perceived perspective. And what this means is that the public simultaneously holds two contradicting views of aging. First, there's this idealized vision that we imagine aging as a time of wisdom that's accumulated over the years, self-sufficiency, active lifestyles, and earned leisure and plenty of income coming in. But then that vision contrasts sharply with what people presume to be this perceived reality or idea of what aging means, which is the messaging that we hear: deterioration and decline and depression. So both of those are both individualistic ways of looking at it, and the actual outcomes are thought to be the result of individuals' decision making. So they also limit the public's understanding of older people's social contributions and the recognition of the kinds of social policies and supports that could improve aging outcomes. So we need to see it from that perspective. Then we have the us versus them perspective in our society, where we see older people are as an other group, right? Separate from everyone else. And the negative view of aging can be seen in the pattern of where we view older people as a separate group apart from everybody else. So it's not valued necessarily because of ageism, obviously. Marginalizing older people makes it easy for people to apply as zero-sum logic. And when they're reasoning about policy initiatives that are designed to support older people and programs for aging, that just kind of dismisses it. And then this also is seen in our generational warfares that we see, especially in the media, like boomers versus millennial and that kind of languaging. All of that is othering, and it serves no one in a positive way. And we need to be conscious of recognizing that all of us are aging, so we're all in this together. There is no separation between age groups, and it should not be framed in that way. And then in addition to that, that other mindset of just like fighting aging, right? Like it's something to avoid. But obviously all of us are aging, and hopefully we will live to an older age, and that it can be a positive experience. And then there's nostalgia. And this one is about thinking like the good old days when we all took care of our older adults, took care of grandma and grandpa, and maybe all generations were living together. There were pensions and social security, and there's lots of, comfort, and people were taking care of each other. But the idea that life used to be better and is getting worse is a common model that the public uses to reason about many social issues. So coupled with this sense of nostalgia is the belief that modern life is threatening people's ability to age well. The public blames modern life for the breakdown of family connections. Children aren't around anymore to take care of their older family members. The economy is unpredictable, which makes it hard to invest or save for retirement. And pensions have been decimated. People believe this is Social Security is potentially doomed. So, and this sounds terrible, obviously, but activating these models just simply feeds a sense of fatalism in society. These are all societal perspectives or messaging that we hear, and it makes it difficult for us to see a systems level change or potential that could improve how we're aging and what it can look like. When we are attached to a way of life from the past and always looking backwards and always thinking it was better in the past, things were always better before, and what happens is that's a barrier. It creates this barrier for us to address what's actually happening now. So it's really important to think that maybe it was better, but this is what we're dealing with right now. We really need to take action and find ways that we can be supportive of each other, and what can we do to make those changes. And then the solutions perspective from this ideological view is the public, generally speaking, shares a fatalistic view of aging. We hear this in society. So when we hear terms like silver tsunami or impending social crisis, those things are fueling that kind of a fatalistic view. And the impact from that leave us feeling pessimistic about our abilities to address the issues at all, right? It can kind of give you the sense of hopelessness and what can I do about that? It's just me. And a barrier that also exists is that we, the general public, also default to that individualistic thinking. And when we reason that life outcomes are primarily due to just individuals' choices as they've lived, then the keys to our well-being in older age must be determined by our individual choices. Thinking that way, it's just putting the onus on individuals. But as a result, it obscures us being able to have the vision to collectively see that the policy level solutions and as a society, that those challenges we face as we age, we can do something about. And so we need to recognize that it will take all of us, right? And by learning about ageism, to me, is the first step. And I'm hoping that you'll see this with what I'm sharing. We all can take action in different ways, small and big, to change this so that we don't have that fatalistic perspective on what it means to age. And so how it shows up, so the ideological, as I just mentioned, it's like that societal messaging that we see that's just too dominant, right? Then it shows up in institutions. So the programs and policies, places that are like, the big systems that exist in our country that where ageism shows up and how that's harmful to all of us. And interpersonal represents the interactions that we have with other people, personally, professionally, individually, with family members. And then internalized, just those beliefs like, I'm too old to do that. And those self-deprecating kind of messaging that we have in our own minds. So with institutions, some examples of what that looks like is the workplace age discrimination. That's just people being pushed out, being forced maybe to retire before they want to, or many people not being able to find jobs at older age when they really need to continue to work. So that's a big problem of ageism showing up in our institutions. Medicare exclusions. We know that Medicare doesn't always cover vision, hearing, and dental. Standard Medicare may cover certain procedures, but it doesn't reimburse for vision exams or hearing exams, glasses, or hearing aids. And we know that going out without getting access to dental care, vision, or hearing exams can lead to serious health problems. So that's risky, right? And we believe that that would be ageist. So we think that people should have access to getting that kind of care as they're aging. So these are institutional ageism examples. And then also, just as another example, in mental health in the US, there's approximately 200,000 licensed marriage counselors and mental health counselors and marriage and family therapists who could provide support and help for older adults. But Medicare excludes that type of therapy for reimbursement in treating older adult patients. And then the crisis standards of care, where that showed up during the COVID pandemic. That was really alarming to us in the work that we do. But what they found was during that time, which was difficult for everybody, obviously, like that was a terrible situation. And in healthcare institutions, in hospitals, they were forced to address their crisis standards of care, which meant like the triaging of how patients would be treated. And they created in certain places, certain hospitals, some were putting older people to the back of triage lines and treating younger people before older people, making chronological age kind of the dictating criteria of who would get treatment. And interpersonal ageism. So these are examples of what it can look like, sound like, right? So George, he's too old to learn the new software. So there's an assumption, that's an ageist assumption. Or another example is we're not going to hire him because he's in his 60s and he won't stick around. So that's an ageist assumption. No one can be certain if someone isn't going to stick around based on their age, right? And then, of course, your knee hurts, you're just getting older. That one I've heard a lot from people in my healthcare presentations of people being dismissed about whatever it is they've come to a healthcare provider about that they're concerned with, and just being told that that's what you can expect at your age. But that's not helpful, right? So we need more answers. And then internalized ageism. what these can sound like for us, like within our own thoughts, or what we say is I'm too old to learn or do or to start that, or oh, that knee, it's just getting older, or I'm having a senior moment. And these are examples of internalized things we think, things that we say. You may hear other people say that about themselves. So that's not helpful to anyone, right? But there is some good news. So I'll share that with you all, that positive beliefs about aging actually can increase our lifespans by up to 7.5 years. It can improve our health when we have positive beliefs about aging. We have a greater ability to recover from illness and injury, and it can reduce the likelihood of dementia by almost half, and improved memory and reversing cognitive decline. These are all from Dr. Becca Levy, the book that she published last year called Breaking the Age Code, which I highly recommend to everyone. And we actually have a book club toolkit on our website that you can get for free, and you can create your own book clubs. I can tell you more about that if you're interested, but definitely it's really to our best interest to find ways to think positively about aging. And probably many of you already do, so that's wonderful. But you can then share that positive messaging with all the people in your lives. So what are some things that we can do to reduce ageism and help other people reduce it as well? So research has found that education, intergenerational connections, and policy and law, all of these actually will reduce ageism. So education, like we're doing tonight in this session together, by learning about ageism, that's really effective in helping us reduce it, because now you understand even more so what it looks like, and you can take steps to go in that direction to continue to end it. Intergenerational connections, any way that you can come together with people of all ages and actually have conversations about age and even talk about ageism, right? And then what it's like to be the age that you are, and compare notes, and learn from each other reciprocally. That will really automatically start to reduce ageist beliefs. And then policies and laws, just making sure that the voices of all ages are heard when policy decisions are being made, when it's addressing older adults. Are older adults being included in the conversations and the decision-making processes, and for programs and whatever's needed, right? Find out what people actually need. We need to be more inclusive in the conversations that occur for decision-making. And then here are some recommendations about communication. So these are recommendations that all come from the Frameworks Institute and the research that they have conducted on ageism. And so what they say is that whenever you're talking about ageism, always be sure to define it and describe it, help people understand what it is that you mean when you say the word ageism, because most people don't. And there's a lot of great resources, but always define it, describe it, and just kind of dig into more about what it looks like and what it is. And then comparing ageism to other isms, we don't recommend you do that. Instead, just refer to ageism as a matter of justice. It's something that all of us, we are all aging, every one of us, and we're all affected by ageism in some way, shape, or form, whether, because this is the society that we live in and it's all around us. So think about it as a matter of justice. And when we're talking about older adults and aging, here also from the Frameworks Institute, one of the things that also is known is that recently the Associated Press and the American Psychological Association Style Guide are both now recommending that to use the term older adults or older people or older person instead of senior citizen. So this comes from many sources of recommendations. And what they found in research was that the words senior citizens and even the word elderly actually conjure up those negative stereotypes about aging and older people. So instead, they recommend that we use the words older adult, older person instead, just because of the stereotypes that are so strongly dominant in society. You could also use descriptive language, which would mean saying something like this program is for people age 60 and over, or something more descriptive like that, rather than just seniors, older adults. And then the us versus them, that which I referred to a little while ago, all of us are aging, right? It's not older people and then the rest of us. All of us are all experiencing aging from the day that we're born. And Janine Vanderberg, who I work with, she likes to say that think about that today is the oldest you've ever been and the youngest you'll ever be, right? So all of us are sharing that. Each day we wake up, we're another day older. And then just the battling anti-aging, instead of using that kind of language, we could just acknowledge that aging is a dynamic process and it's very diverse as we get older. And then also the choice, better planning and control. We could instead focus on improving social context and finding creative and innovative solutions. And then the demographic change, right? Especially in the media, we have seen so much of a focus on language like silver tsunami, gray wave, going off the demographic cliff, all of that kind of catastrophic thoughts and languaging, and that doesn't help anybody, right? So instead we just talk about the facts, right? People are living longer, birth rates are declining. That's the reality. These are just factual things. We don't have to make it something that seems so overwhelming that no one can do anything about it. And then the zero sum and finite resources, we could then now refer to the demographic shifts that are happening as using our ingenuity, re-envision what's possible, create policies and programs that are addressing the changing world that we all are living in, right? So there's a lot we can do to just change the way that that's depicted in society. You all have access to, I think, to the link that this is a picture here of our guidelines for age inclusive communication. So you're all welcome to check that out. And we have tips on what you can do for websites if you're at work. There's links to images and graphics to use and languaging, but it's really helpful. There's, I think, about 3 pages in the guidelines now, with just different resources to help you understand more on what you can do in a public way with what you're sharing and language that you're using out there in the world. So definitely recommend checking that out. And then some other ways that you can participate in helping with ending ageism would be Dr. Becca Levy's book, Breaking the Age Code. We have the book club toolkit that you can download from our website for free. And I could share the links with Pamela for everyone as well. But definitely it's such a wonderful way to bring people of all ages together, to have a book club and read that book and talk about what ageism looks like, because that's going to be what helps us change it, right? To have these conversations. And if you're in a workplace, review the website and the materials and handouts of different things that you have, what languaging is in there, and you can use our guidelines to help guide that. Just, making sure that you're not reinforcing all of the ageist stereotypes that do exist in society. And then share strengths-based stories about older people rather than the negative messaging that we see so dominantly. There's all kinds of wonderful stories about people and as they're aging. So we have more examples to understand how we can age. And then the birthday cards, that's on our website. We have age positive birthday cards, and hopefully you'll see more of those in society, not just from our website, but we'd like to see more of those coming forward, in our stores where we're buying birthday cards. And then support age inclusive public policies. As you see those show up, make sure that, if you care about policy issues, then pay attention. And is age part of that? Are older adults being referred to or, included, and our younger people as well? Maybe they're being overlooked too, right? So all people of all ages should be part of those conversations. And then the us versus them, really definitely want to avoid being separate, right? Separating groups based on age is just not helping anybody. So I'll ask all of you if you want to type in the chat or whatever works best for the group, but what is one thing that you'll do in the next 30 days to help us with ending ageism? It could be a little tiny thing, it could be something bigger, but if people want to type that into the chat, I would love to hear what people have to say. So
Work on, using more inclusive language.
Great.
Consider the language I and us.
I mean, yeah, like we can use,
Encourage, I'm sorry, go ahead.
yeah, the we, right? It's all of us, right? So
Yeah.
like, yes.
Yes, I would assume that that's what that meant. Encourage positive language.
Chris, there was a question while folks are typing their responses as well. The question came in and says, can we speak about the difficult transition from work to non-work that many of us struggle with?
Before you answer that, Chris, I would just say that there are going to be some other modules coming up that deal specifically with life and purpose and designing your life, going from work to non-work. So that will be coming up, but please tell us what your thoughts are.
Yeah, from work to non-work. That's not my specific area where I have tons of expertise, but from the side of ageism, I can speak to it on that perspective. And knowing that, like, if you've gone from, working and now not working, finding passions, things that you're wanting to get involved with, if you're choosing not to work or don't need to work anymore, that it's really important to stay engaged with life in some way, right? And to continue being involved with maybe the community, people that you care about in whatever way that can look for you. But I know that how our society is structured, it kind of is part of the problem, right? So I would actually love to attend all your other sessions to hear what people have to say on that topic. But with age, I think being conscious of ageism, don't try to learn more about it. Don't fall into the stereotypes or, believe the assumptions that are made about older people, right? And show your value, represent what it is that you value and what brings meaning and purpose to your life. That is the most important thing, is having meaning and purpose at any age, really. But our society definitely can do better in how we view older age and retirement as well, and just not fall into those stereotypes that see it as something that's not as valued, because there's so much value, across our entire lifespan. And as we're older, there's so many ways that we can contribute, and there's lots of examples. And I'm sure you have wonderful speakers that can provide great examples of that.
Yeah, we will be having some more in-depth discussion about that. And so I would invite the participants to stay tuned for those and to make sure you can take those in. And they're all on Mondays at 4. We had someone in here who said, start a children's book. She said she have in mind that stars a grandma who helps her granddaughter explore and solve a mystery.
That she's written the children's book?
No, well, she said start a children's book. She says she has in mind that would be the theme, that it stars a grandma who can help her granddaughter explore and solve a mystery.
I love that. Yeah, definitely would love. I would buy that book. I'd be happy to see that.
This is really interesting. Invite you on a podcast to discuss the effects of ageism on health. That's something showing the positives of aging when someone mentions a negative.
Yes, absolutely. Right. We need, actually, that's something that I know we have lots of resources on our website and of examples of, like, especially for my side, on the healthcare side of things, like interactions, like what you may hear as a patient from a provider, then what you could say in response to that, like those kind of conversational tips.
There's someone mentioned there's a lot of data on the benefits of volunteerism.
True. That's extremely important. If
and Lucy, you had be more sensitive to. I'm not understanding what you have. Be more sensitive to what. Did you want to explain that a little bit more, or just be more sensitive to what people are saying?
Pamela, I think she's trying to say, unless she wants to come with me, there's a lot, she says, be more sensitive to what others say.
Oh, to what others say. Okay, got it.
There it is. Perfect. Thanks, Kris.
Yes. Yeah, thank you. Yeah, the great comments. And so if people have questions, I'll go to my next. Well, I just wanted to share this graphic with everybody quickly. So every month we have like a virtual webinars. It's called a coffee chat. And so we do a different theme every month. And a few months ago, we did one where we asked everyone to explore this question: what would a world without ageism look like? And so on here, you'll see these different categories, and these were comments that came in from attendees. And we had an artist create this graphic to show what that could look like. And so it's just an example of how we do our work in very creative, innovative ways. And we're really proud of what came out of that one session that we held. And we just think that this is great. And we invite people to share this as well. It's something that I could send this to Pamela, but you could all share this graphic if you have websites or anywhere in your work, if you wanted to share it. Or it's free to anyone to share. So just wanted to let y'all know about that.
They will be getting a copy of your PowerPoint after today in another email. So they will be getting that. Also.
Great.
So that
Okay.
would be, yeah.
And I can send you the link directly too, if they want, like the.
Okay. There was a comment to discuss the relevance of aging with our city DEI director. So that was, that's interesting. That
What was there a specific question, or just that they are going to talk about?
no, it just, I lost it now, just a minute. I think it was a suggestion.
Oh.
Yeah. And then here's another one. Don't forget to mention Ashton's Applewhite's work on this topic. Her book, This Chair Rocks.
Yes.
Oh, that's cool. Yeah.
That's a really
Great additions. I want to jump in really quick before we open it up to the Q&A. Kris, thank you so much. That was fabulous. We want to make sure that before we have some folks drop off for the Q&A, I want to go ahead and pull up. So Kris, it might pull down your screen share, but let's see what happens.
Okay.
Let me see, and then we can pull that back up. Let's see, I'm just going to pull up my screen so that we can do our drawing. Is everyone seeing my wheel?
Yep.
Perfect. I was adding names. Now remember, we do have to be present to win. So I'm going to shuffle these so that they aren't in alphabetical order. And then we'll go ahead and do the drawing. And then if you want to either send me your email, or in just a moment, I'll put my email in the chat. Whoever our winner is can reach out to me. And as I said, we'll go ahead and get you a $50 Amazon or it can be Amazon or anything of your choice, an e-gift card. Let me just spin the wheel. And then we'll make sure they're present. All right, so our winner is George. Oh, yep, George is still on the call. So George, congratulations. You are our door prize winner of a $50 e-gift card. If you want to either send me your email through the Zoom chat, or I will just put my email in there so that you can reach out. We will get you the e-gift card of your choice. So really appreciate everyone being here. I'll take down my screen and turn it back over to Kris for our Q&A. If folks want to ask questions, or if Kris, if you want to get that screen pulled up, you're more than welcome. But thank you so much. That was wonderful.
Thank you, Bree. All right, I'll put the screen back up in case people want to write down our information there. But I would be happy to have questions come in if anybody has questions or thoughts. Anything.
I'm looking at the chat and I don't see any questions right now.
Okay.
George is really happy.
Yes. Congratulations, George. Great. Yeah.
We have more door prizes at the end of every session. So thanks for joining.
So if you come to all sessions, so that's 8 sessions times 50. I mean, wow.
It'd be great. I know. Wonderful. Well, I think it was great to have all of you here. And if you do have questions, you can reach out to me, and you'll have my contact information and the slides and handouts from Pamela. Will share all of that, but I would be happy to answer questions anytime. But the work that we do, it's there's a lot of different campaigns that we present. So it's what we had here tonight. There's one on healthcare that I do. We have one on the workforce and ageism in the workforce. We have an intergenerational program where there's a toolkit, the free toolkit that you can download to have intergenerational conversations, and then the book club. So there's lots of different ways that you can get involved in this work. But it's a big lift. I know, like ageism is so normalized, right? So it's hard for us to sometimes recognize it, but baby steps. So I'm really happy that you all were here to be part of
Kris,
this.
I really appreciate, well, we all appreciate what you've shared with us. And I know one thing for me that has really struck me throughout these last few weeks and learning about this is the amount of internalization that I held within my own self about my own aging or, anyone else. You're right, it begins when you're young and it carries through unless you're presented with other information that will challenge that. So thank you so much.
Yeah, so right. Yeah, thank you for sharing that. And that is part of what the problem is, right? Because we hear it's like so dominantly negative in our society. So if we are rarely exposed to positive examples, then it's really kind of hard for us to imagine something else that if we've never seen it, right?
Right.
Yeah. That was
There is another comment about that it's also important to emphasize that ageism isn't only an issue for older adults, which is true, which is what you said, during that. It's that I think that whole phenomena of how we separate and put people in boxes, whether it's by age or education or whatever. But please comment.
Yeah, absolutely. Right. Like that, it's definitely a problem for younger people and just that languaging, right? When we even just hear the, millennials are this, right? The labeling of like millennials, and then there's language like entitled millennials or that they're not reliable at work. There's stereotypes that exist in all sorts of media directed at specific age groups, right? But that's not helpful to anyone. And none of us are all one thing, right? I mean, every one of us are so diverse in who we are, how we show up, how we live. And when we apply these generalizations to whole groups of people, it's doing a disservice, and it's actually just harmful ultimately to everyone. So we definitely want to address that when we see it. And we aren't confrontational. It's just like calling that out in a respectful way of just like, hey, well, here's what aging, here's what older age is for me, or here's what being a teenager means to me, or this is how I show up as a teenager, or whatever age you are, right? Like,
Yeah.
Descriptive language.
Yeah. That was one of the things that we were trying to do in this series is start with you to sensitize an awareness about what is out there if we're not already aware of it, so that as you pursue and create your life, in your longevity of life, you can be aware that that's out there, and that may or may not, be to your advantage or disadvantage. So that's why we wanted to make sure that we laid the framework and the foundation so people could become in tune with that.
Yeah.
So
right, it's so helpful, like in all areas of our life, right? Like as we're in retirement, whatever that looks like for each individual person, but understanding that ageism is out there in how you're engaging with the world and knowing how you can be better prepared to respond to it.
Yeah. We have another comment that says, look what is happening in the political arena by connotating age with negative stereotypes.
Right. Yeah. That's a serious problem, right? That's a perfect example of ageism, and it's generalizing. It's not looking at an individual and what that individual has to offer, and where, there's a lot of problems with that as well. It's just more of that divisiveness. It's not
Right.
Yeah, there's so many ways it's showing up. So when we're seeing it, we can take that step back and think, all right, if they're addressing something based on someone's age, then that's ageism. So what can we do to change the way it's being depicted and described? And what can we counter that with?
Yeah. Well, I wanted to just mention briefly that we do have in the upcoming modules, we do have estate planning coming up next week. The do's and don'ts, we have Social Security and retirement following that. Then we have another one that there's, which I mentioned earlier, retire by design and meaning and purpose in retirement, which I think will also address the comment we had earlier. And then there's a new one called Brain Wise and Body Foolish, where Dr. Tad Schnecknilder will be talking a lot about that phenomena of when you're working and then you're not working, just in terms of what happens with your body and some of the statistics that have been relative to that whole phenomena. And then we have Making Retirement a Reality with the Ant Credit Union staff. And then our last one will be the Medicare Basics, which will be talking basically about what is Medicare, and that it's just in time for those who are already on Medicare, or even know about some of the acronyms that goes into open enrollment, where people have a decision to make for their next year in terms of what plans they want. So anyway, that's I think what's coming up in the future. So does anyone else have any other comments? Bree, did you want to share anything more at this time before we call it?
Nothing other than a thank you. Thank you so much to Kris for presenting tonight on this very wonderful topic. Well, not wonderful, it's a tough topic. So thank you so much for sharing the pieces of it. And just thank you to all of you for joining us for this series and for future sessions. Thank you. And thank you, Pamela, as well, for our continued partnership.
Oh, thank you, Bree, and for the door prize. That's really great. It adds a little spice to everything. So, and George, of course. So, all right. Well, we hope to see you all in our next sessions, and you will be getting an email following this this module, and it will be sent out. And we do have a little survey. If you'd do us a favor and enter that and answer that, we'd be greatly appreciative. So, Jared, if you're still on board, I'm turning it over to you.
I mean, you pretty much handled it all, so I really don't have anything else to add other than echoing Bree and Pamela. Thank you all for joining us today. I hope this information was helpful. If you haven't already registered for next Monday's event with estate planning do's and don'ts, the registration link will be in the follow-up survey email that goes out in a few moments. But
Great.
Pamela and Bree, if there's nothing else.
Okay. Thank you, Kris. Thank you so much. Yeah,
Have a great evening.
Bree.